Michelle Graves, your host on The Power of Money, and I'm honored to have you as a part of my world in this coming segment. With The Power of Money, as you know, we are interested in three things. First, that you get the necessary education so that you and your family will have the information to do well in these difficult times. The second thing I'm interested in is for you to be empowered to prosper. I want only the best for you, but you can't get that if you don't have the education and then the drive to make it happen. And the final thing, and perhaps the most important thing, is that you be energized. Because life is more than a journey. Life is about living. And so I want you to learn these things and to be empowered and encouraged and energized. I'm Michelle Graves. Now here we go. Today's segment of Power of Money. And we're going to continue our conversation from my first show on Medicare 2022. Yes, it's here and it's upon us from October 15th through December the 7th. And it is at that time that you can enroll in a plan or switch plans. And so my reason for doing this as a documentary, an informational documentary, is so that you can go right online and listen to the things I tell you and begin to work it out for yourself. As I said in the last show, it's very important that you become an advocate for yourself. You cannot expect anybody to have all the answers to your circumstances. But it is very important as you are aging in, and it's a term that means you're turning 65, that you have at least taken the time to look at this, in my opinion, this most important aspect of growing older. It is an absolute truth that your body, I don't care how fit you are, your body is not going to move the way it did in your 20s, okay? It's also going to have conditions that didn't seem so important in your younger years, but now it's here upon you, okay? You may be dealing with arthritis, or you may be dealing with high blood pressure, or you may be dealing with all kinds of things that come along with growing older. Your body is not a car. It's not a machine. You can't replace the part. And sometimes the body just quits, which is known as transitions into death. So in my estimation, Medicare is core and foundational to your health, particularly since this is a federal program that President Lyndon Johnson, in his forthrightfulness, put into place in 1965. Since that time, we have had over 65 million people enrolled in this phenomenal program. And it goes without saying that many of our senators and politicians are saying, we need to do this for America, period. Well, I can't get into that, although I do feel it is horrible that people that are younger than 65 and are not on disability, Social Security, and get sick, find themselves in a bad place, okay? Because in America, if you don't have some kind of insurance or coverage, then you will find yourself facing some very tough times. So I put that out there for your consideration to motivate you if you are age 65 or approaching to go on and get moving in terms of doing the necessary research. Listen to my first video on Medicare 101, what you need to know, your options, your choices, and now listen to this. If you are already in Medicare, this particular program may not work for you, but I bet you got people in your family, circle of friends, associates, church, synagogue, mosque, you've got people that this will meet their needs as far as having the necessary information to get moving. So the purpose of this show is to first help you determine what your initial enrollment period is, decide whether to enroll in Medicare Part A and Part B when you turn 65. Now, I talked about that in the previous show. And then find out how to sign up for Medicare Part A and Part B, or opt out of Part B. Part B is, again, it's option for some people that are working for employers. You may already have coverage, okay? So we're going to talk about that in making it possible. The information I'm sharing from you is on a direct basis from the Center for Medicare and Medicaid Services, which has been gracious enough to provide me with this information so that I can use the platform that I am on as the Power of Money with Michelle Graves to inform you and to educate you. So let's start with the first area that we want to talk about, and that is determine your enrollment period. If I can see that first slide. And I'm going to be, yes, the second one. Yeah, connecting the dots. I'm going to help you to do that. Let's go to our first slide. Okay, the initial enrollment period. There are only, and this is very important, certain times when people can enroll in Medicare. This is not a 24-hour, 12-month activity. There are designated times. We're going to talk about the initial enrollment period, which is known by the acronym IEP. The first time you can enroll is called your initial enrollment period. Your 7-month IEP usually begins 3 months, that's right, 3 months before the month you turn 65, and includes the month you turn 65 and ends 3 months after you turn 65. That is known as your initial enrollment period. That's for all of us. That is a designated time for you. You can call 1-800-MEDICARE for help or assistance in making that determination, okay? You should review all the material I'm going to discuss with you during this limited time I only have an hour, and decide whether it's best for you to enroll in Part A or B. And it's best to make that decision before you turn 65. Make sure you have your facts. Now, the second thing is, do I enroll in Medicare Part A and Medicare Part B? Medicare Part A, as I said in my previous show, is called hospital insurance. It helps cover patient hospital care, skilled nursing facility care if you have to go into a facility after hospitalization for rehab and for recuperative. It is not NOT, long-term custodial care. Okay, no. Although, and I'll say this, many times if you're not improving while you are in the hospital, they will send you to a facility for rehabilitation, and if you do not improve per guidelines, then you will find yourself not only out of the facility, but being told that you may want to consider long-term care. And typically rehab facilities don't do that. But if you are given that mandate, and it happens every single day, not everybody gets better. Not everybody recovers in their right mind with their faculties and all of their moving parts moving. And if you are referred on, then you have choices to make. And sometimes it doesn't sit well, which is why I said over the years, and I'm never going to back away from this, you better get yourself some long-term care insurance to make sure you can pay for that. It's a statistical fact that most people are going to wind up in some type of a facility, whether it's a year or longer, but you are going to be able to pay for that, I hope. And the payment's either going to be out of your own check writing or out of private insurance. So, moving on. Most people should enroll in Medicare Part A when they turn 65, even if they have health insurance from an employer. This is important. Most people have paid Medicare taxes while they worked and therefore do not have to pay a monthly premium for Part A. If you look at your pay stubs, you'll see it. Under Medicare, it's right there how much you have to pay into the system. So if you have paid in consistently over the years, you are probably eligible. To find out, you can call Social Security. They'll tell you. They'll tell you if you haven't paid in enough quarters, what you're going to have to do. But if you have paid into Part A, then you should go on and consider going on and turning on a spigot for Part A coverage. If you delay Part A until a later date, such as people that contribute to a health savings account, or those who have to pay a premium for Part A, again, these are considerations you have to look at. Medicare Part B is sometimes called medical insurance. It helps cover services from doctors and other healthcare providers, outpatient care, home health care, DMI equipment, durable medical equipment like wheelchairs, and some preventive services, including certain vaccines and cancer screenings, which I want to remind everybody listening that under the Medicare provisions of 2022, COVID is paid for. Okay? It's covered. It's paid for. It's not out of pocket for you. Most people need to enroll in Part D when they turn 65 as well. Only people who have health insurance from their employer or their spouse's employer may be able to delay. Now let me help you to understand real clear that I pay Part B, and everybody that I know that's over age 65 is going to pay for their Part B medical insurance. That's doctors and all of that. There is a premium. Last year it was $144.80. I don't have the new figures for 2022, but again, they'll be probably slightly more, but you will have to pay for Part B unless you're under your employer's group plan or your spouse's. You'll have to deal with that. How much will you have to pay for Part A and Part B? The Medicare premiums vary depending upon how long you and your spouse have worked when you first sign up for Medicare and your current income. Most people do not have to pay a premium for Part A, which is hospitalization. If you and your spouse, or I should say if you or your spouse worked and paid Medicare taxes for long enough, usually about 10 years, you won't have to pay a premium for Part A. This is called premium-free Part A. If you didn't pay Medicare taxes long enough, you can still get Part A, but you may have to pay a monthly premium. This is called premium Part A. Everybody pays a monthly premium for Part B. It depends on your income and when you enroll, but most people will pay the standard that I gave you, $144.80. That was last year, 2021. Don't have the figures for 2022 yet. Okay, you can get an estimate by calling 1-800-MEDICARE if you want to know. And if, of course, you can always call Social Security, who will tell you whether or not you have met guidelines and that you can enroll. They're also the people who will send you your card, because your red, white, and blue card, which is just as important as your Social Security card. Call them. I'm not the Social Security. I don't know how much you've paid in the system. I don't know what your premiums will be, but like I said, I just gave you the number for Medicare, which is 1-800-MEDICARE, or you can call Social Security and get answers. They are 24/7, and if you have to wait, just put your phone on pause and wait, because there are millions of other people calling trying to get the same information. Again, should I consider delaying enrollment in Part A, Medicare, and Medicare Part B? If you're working, you should contact your employer or your union benefits administrator before delaying, hear me well, Part A and Part B, to find out how their insurance works with Medicare. Your employer coverage may require you to enroll in Part A and B in order to get full coverage. Again, check with the HR, with your employer or your union benefits administrator. Before making any decisions, read the situations below that I'm going to describe and see which one applies to you. I'm currently have health insurance from a previous employer, including COBRA or retiree health insurance. If that's your situation, you should enroll in Part A and Part B when you turned 65. Again, if you did not enroll in Part A and B during your initial enrollment, you'll have to wait to sign up. This may cause a gap in your coverage, and you may have to pay a lifetime late enrollment penalty. And that penalty increases the longer you wait. Listen, folks, this is the dark side of Medicare. And that is, they are serious about you handling your Medicare affairs. Do not delay because you were not willing to take the time to get the information, because this will, in effect, cost you for life. It is a penalty, and it's not pretty. Let's go to situation number 2. I have TRICARE or CHAMP VA coverage. Your decision to enroll in Part A and Part B depends on whether you're eligible for premium-free Part A. If you are eligible for premium-free Part A, you are required, listen here, you're required to enroll in both Part A and Part B to keep your TRICARE or CHAMP VA coverage. How many of you veterans knew that? But there it is. Here's a warning. If you do not enroll in Part A and Part B during your initial enrollment period, you have to wait to sign up, and again, this is going to cause a gap in coverage and a penalty, an enrollment penalty. If you are not eligible for premium-free Part A, enrolling in Part A and B is optional. But if you do not enroll during that IEP period, you'll have to wait to sign up, and the penalty increases the longer the wait. Okay, gotcha. So that's my answer to veterans that have TRICARE and VA, CHAMP VA coverage. Third situation, I have health insurance based on my or my spouse's current employment from an employer with 20 or more employees. And this includes those with federal employee health benefits. Okay? Now listen, there's a note here. If you have COBRA or retiree coverage, or if your employer gives you an amount of money to purchase health insurance, you do not have health insurance based on current employment. If you have any of these types of insurance, you should find out that situation and plan accordingly. Your decision to enroll in Part A and B depends on whether you have a high deductible health plan with a health savings account known as an HSA. If you do not have an HSA, Part A, if you qualify for the premium free and you don't have an HSA, you should enroll in Part A when you turn 65. However, if you have to pay a premium for Part A, you can delay Part A until your spouse or you stop working or lose the employer coverage. You will not pay a premium for delaying Part A coverage as long as you enroll within 8 months of losing your coverage or stopping work, whichever happens first, okay? Again, to HSA people, if you don't have an HSA, Part B, you can delay Part B until you or your spouse stop working or lose that employer coverage. Okay, this allows you to save the cost of your Part B premium. It also allows you to delay or postpone the one-time Medigap open enrollment period until a later time when you may want to purchase this coverage. I talked about that on a previous show. You will not pay a penalty for delaying Medicare as long as you enroll within 8 months of losing your coverage or stopping work, whichever happens first. You want to plan ahead and enroll in Part B at least a month before you stop working or your employer benefits end. Now, this has to deal with people that are working with employers with 20 or more employees. Okay, I have a high deductible health plan and a health savings account. Once you enroll in any part of Medicare, you won't be able to contribute to your HSA. If you like to continue making contributions to your HSA, you can delay both A and B until you or your spouse stop working or lose that employer coverage. You will not pay a penalty under this scenario for delaying Medicare as long as you enroll within 8 months of losing your coverage or stop working. You should talk to your employer benefits manager. I'll say this over and over and over again. Talk to HR employer benefits about which situation works best for you and whether it makes sense to delay Part A and B. That's what they're there for, and they're very familiar and comfortable with all these scenarios. Now, here's another one. I have health insurance based on my or my spouse's current employment from an employer with fewer. Now, we did the more than 20, now we're doing 20 or less, with fewer than 20 employees. Okay, you should enroll in Part A and B when you turn 65. In this case, Medicare pays before your employer's insurance. That means that Medicare is the primary payer for your health coverage. That's simple enough. Please be aware if you have COBRA coverage or retiree coverage, or your employer gives you an amount of money to purchase health insurance. A lot of companies are doing this now, okay, on state governments, etc. You do not have health insurance based on current employment. If you have one of these types of insurance, you need to look carefully, talk to your employee benefits manager, and get the facts. Okay, final scenario. I have health insurance from the health insurance marketplace or other private insurance not directly related to my employer. If you're eligible for premium-free Part A, you should enroll in Part A and Part B when you turn 65. That is going to impact on many, many people who were furloughed or lost their jobs or went into the Affordable Care Act or health insurance marketplace. You are eligible to enroll, and you should when you turn 65. If you have marketplace coverage and you're getting the reduced premium or tax credit, it will stop. Hear me well. It will stop once your Medicare Part A, which is your hospitalization, starts. You won't need this coverage once Medicare begins. So don't do it. Don't double dip, because if you paid into Medicare Part A, there's no premium required anyway. Okay? Now, there's a warning. If you're not eligible for premium-free Part A, you can choose to stay in the marketplace to get your coverage. That coverage may cost less. But if you choose to enroll in Medicare Part A and B later, you will have to wait to sign up, and you may have to pay a late enrollment penalty, and that penalty increases the longer you wait. So, again, with those kind of questions, you need to call Medicare, 1-800-MEDICARE, okay? Now, another situation, I have VA coverage. If you have only VA coverage, only, I didn't talk about TRICARE or CHAMP VA, only VA coverage, you should enroll in Part A and Part B when you turn 65. Now, I can't tell you how many veterans don't know they could and they should do this. Okay, why? The VA themselves, go to their website. They will tell you that you need to do this. Why? Because you have a much more expansive network. Why? Because you could be in a city without VA facilities. Why? Because many of the benefits under Medicare are not available today at no cost to veterans, and that would be available to you under your Part A and Part B. So you want to use the situation I just described if you're only getting VA coverage. Okay, you may want to consider the Part A and Part B. Now, many veterans are getting prescription drug coverage free, okay, even on their status is just VA. You want to make sure that all the medications you are getting are covered, okay, because if they're not, then we want you to enroll and also secure prescription drug coverage. You're going to have to deal with your local VA pharmacy department on that list, see who you're getting. But be aware that Medicare for people 65 and over, whether you're a VA only guy or gal or the regular population, is available to you. You need to take advantage of it. You really do, okay? Finally, I do not have health insurance. Then you should enroll in Part A and Part B when you turn 65. Okay, now if you don't enroll when you turn 65, then you may be stuck with paying a lifetime penalty, enrollment penalty, and the interest and the penalties increase the longer you wait. So, I want to encourage everyone that's eligible, meaning turning 65, they don't look at your health, they don't look at your income. You got to get this done. Call Social Security and get your card. Okay, check with your union benefit administrator if you're union, or your regular employer if you're not, and find out what you can or cannot do. If you're preparing to retire, this is very, very important that you take this step. Okay, now, how to sign up for Part A and B or opt out on Part B. This is what I'm going to talk about first and in wrapping up this entire thing. First thing, how do I get Part A and B? For some people, it'll be automatic. For other people, they can only get it if they complete the application with Social Security. So you first need to figure out what applies to you. I'll tell you right off, most people you're going to have to go to Social Security. Okay, now let's look at the situation that may apply to you. I will be getting benefits from Social Security or the Railroad Board at least 4 months before I turn 65. Now, if you will get benefits from Social Security or the Railroad Retirement Board at least 4 months prior to turning 65, you don't need to do anything for Part A and Part B. You will automatically get it starting the first day of the month you turn 65. I'm talking about the benefits from Social Security and the Railroad Retirement Board. If your birthday is on the first of the month, Part A and B will start the first day of the prior month. You'll get a Welcome to Medicare packet and your Medicare card in the mail 3 months before your birthday. So don't be panicking. They're on track with you. They have a record of everything you've done, your earnings, they have all that as Social Security. It's an amazing organization, how they're able to keep all that stuff. Technology, I'm serious, technology. If you don't receive your packet, you need to contact, with your card, you need to contact Social Security. Now, if you live in Puerto Rico or a foreign country, you'll get Part A automatically, but you will need to enroll in Part B. So you'll need to complete an application for Part B, and you can get your forms in English or Spanish, and you can also contact your local Social Security office to coordinate this or consult with the U.S. Consulate office where you live. Situation number 2. I won't be getting benefits from Social Security or the Railroad Retirement Board at least 4 months before I turn 65. If you aren't getting benefits from Social Security or the RRB, you'll need to submit an application to Social Security to get A and B. That's your basic Medicare, okay? If you want Part A and B coverage to start when you turn 65, sign up during the 3 months prior to 65, and you can sign up by applying directly to the Social Security online at socialsecurity.gov, or you can call them at 1-800-772-1213, or if you're dealing with the railroad benefit, you can call them at 1-877-772-5772. Just as a sidebar, I was not aware of how many men and women are involved in the railroad system. I didn't know that. That's a huge system. You want to take responsibility for that, and I would suggest that if you delay on getting enrolled, your Part B coverage will be delayed, and this could cause a gap in your coverage, so you don't want that going on. Now, after you have enrolled in A and B, and I'm almost wrapped up with these fact sheets, okay? And if you'd like to get a printout of them, you let me know. Once your A and B starts, you will have health coverage under, and this is important, Original Medicare. Because Original Medicare does not cover all of your health care expenses, you should consider whether you need additional coverage at that time. Now, some people get additional coverage through their employer or retiree insurance, but there are additional types of insurance available for people under Part A and Part B, including Medicare supplement insurance known as Medigap, Medicare Advantage plans, which I talked to you on the earlier presentation, which has add-on benefits that can include dental, vision, hearing, silver sneakers. All that is in your advantage. And you can also have the Medicare prescription drug coverage. That again is offered by private health insurance carriers. So you can call Medicare at 1-800-MEDICARE to learn more about these different types of insurances and to be aware. You can always contact your state health insurance assistance program if you think you're going to need assistance, or you can get, again, help in that venue. Now, recognize that with open enrollment, which is taking place October 15th to December 7th, that is an opportunity to shift into these other plans if you have enrolled in Medicare Original and you didn't do that then. Okay? So there's one other area I'm going to talk about in the remaining time, and that is I want to delay Part B but start Part A when I turn 65. Some people will automatically be enrolled in Medicare but can choose to delay their Part B coverage because remember, you're going to have to pay for that. Okay? Now, for those that are lower income, you can talk to Social Security about getting qualified to have that premium reduced or removed. Seriously, it's real. Other people can only get Medicare if, again, you complete that application with Social Security. So you have to make a decision as to what applies to you. Here are situations. I will be getting benefits from Social Security or RRB at least 4 months before I turn 75. You're going to get it anyway. If you want to delay your Part B coverage, you must refuse Part B coverage before your Medicare coverage has started. Listen again. You must refuse Part B coverage before your Medicare coverage starts. You can follow the instructions on the card you received, or you can contact Social Security at the 1-800-772-1213. I won't be getting benefits from Social Security at least 4 months before I turn 65. If you're not getting benefits under the venue of Social Security or the RRB for at least 4 months prior, you'll need to submit an application again with Social Security to get Part A, even if you don't want to do B. You have to contact them, and they will talk to you specifically. Recognize, if you decide not to enroll in Part B, your next opportunity to enroll will depend upon, again, if your spouse is working or you're working for an employer that is already providing benefits, then there you are. But again, when your employer coverage ends, you're on a clock, and you must take care of that within the 8-month window for losing coverage. And the second thing is if I and my spouse are not still working and do not have coverage with an employer. Well, if you do not enroll in Part B during your 7-month initial enrollment period, remember 3 months birthday, 3 months after, you'll have to wait until the general enrollment in January of each year. And you will probably be subject to a lifetime late enrollment penalty. Okay, with Part B, the penalty will increase 10% of your monthly premium for every month premium period that you were eligible and did not do it. This is never forgiven. You must know they're serious. Now, if you don't want to do A and B, here is where you will be. If you don't want to do A and B, there are certain requirements that you must check again with Social Security and see how that needs to work and see if you can delay Part A and figure out with their assistance what works best for you. Again, you can refuse Part B, but there are some specific steps that are required. Okay? The only way you can get out of Part A is you have to withdraw your original application for Social Security benefits and repay, did you hear me? Repay any benefits you've already received. Okay, now, again, final note. I got 2 more and then I'm done. I won't be getting benefits from Social Security or RRB at least 4 months before. If that's the case, you sign up for Medicaid when you stop working or lose your health insurance coverage or your spouse's. Simple. Again, it depends on your situation when you need to enroll. And if you have employer coverage, you can still enroll in the premium-free Part A at any time after you're first eligible for Medicare. You should start Part B coverage as soon as you stop working or lose your current employer coverage, even if you sign up for COBRA or retiree health coverage from your employer. This is important that you follow these rules and recognize that if you have an HSA, you should stop making contributions to your HSA 6 months before you sign up for Part A and B. And finally, I and my spouse are not working and do not receive coverage from an employer. If you did not enroll during your 7-month initial enrollment period, you have to wait for the Medicare general enrollment, which begins January the 1st. Okay? And recognize that in most probabilities, you're going to be looking at a penalty for Part D because you did not enroll when you were eligible. So, where can you get more information? You can get other fact sheets from your Introduction to Medicare, Medicare Decisions for Someone Near 65, and Medicare Decisions Over 65, or you can call the 1-800 number Medicare. These things will help you. Please don't forget, if you're working, to contact your employer or union benefits manager if you are union. Very important information. This particular discussion that I've had with you today deals with people who are aging in, as we call it, turning 65. And again, if you can remember, 3 months before the month you're born in, and you have until 3 months after the month you're born in. Okay? If you're getting Social Security or Railroad, again, it's already taken care of for you. You'll get your information, your plan information in the mail. If you have any questions, I'm going to urge you to talk to Social Security first, and then you can always call Medicare. This is a 24-hour, 7-day-a-week offering for you. They are serious about you understanding what could be a complicated connect the dots type of a situation. I, as Michelle Graves, senior citizen now, and the money lady, don't have all the answers. I'm not even going to pretend to. That's why we have agencies that are committed to helping you. My goal in doing this presentation is to help you to get information that can impact on your decision making. And by all means, hear me well. By all means, do not say, oh, I'm not going to enroll. What are they going to do? Oh my gosh, at some point, it's going to catch up with you. It's kind of like not paying taxes. At some point, it's going to catch up with you. And believe me when I tell you, the penalties are stiff and for a lifetime. Now, the only exception is if you have a very low income. And again, Social Security can advise you on that. But don't you try to throw the dice. Play by the rules. Take advantage of an amazing federal health plan for senior citizens in the United States and their domiciles, including Puerto Rico. So, closing out today's session of The Power of Money, I hope you have enjoyed this. And please, if you have any information needs, don't forget to go to my website, michellegravesonline.com, and shoot me off an inquiry, and I will try to get you some assistance. But I think where you need to start is, number one, saying, I got to do it. And then secondly, beginning the research to get it done and calling the correct federal agencies to get your questions answered, read the collateral information, and go from there. I'm so serious. There's so much I've learned. I'm on Medicare right now. I have a PPO because I travel. That's a specific Medicare Advantage plan where I don't pay any premiums. I'm allowed to see doctors in hospitals all over the United States. My travel is covered significantly. I don't have to buy Medigap. That's my choice. I did the research. I cannot suggest to you at this very early stage what works best for you. But I will say that before you call me about having a face-to-face, that you do all of the necessary research, understand that you are a self-advocate, and understand that I can help you better when you know what you want, which is my doctors, my medicines, am I in the service area? Know these things and know what works for you. What works for you is not necessarily what works for your spouse. And just know that we are all committed to getting through the season called Aging with Grace. Grace. Thank you for being a part of today's segment of The Power of Money with Michelle Graves regarding connecting the dots with Medicare, turning 65. Thank you so much. Appreciate your time, me being in your world and you being in mine. And together we can get through this. God bless you richly. You take care. Bye-bye.